Mr. Nived Mishra, would you like to say something about, do the doctors here need any restoration of image?
My first point, of course, is that I think Mr. Amir Khan has been a great success in his pursuit. The fact that we are discussing it here today itself is what he wants. This is exactly what he is looking for. There is a problem, let us look at solutions. He has given some solutions also. In my capacity working with Government of India, I was once covering the visit of our late Prime Minister, Mr. Rajiv Gandhi. He was in US and he was meeting the President. One of the discussion was on environmental issues. And based on the brief that we all had given, our Prime Minister said that, Mr. President, World Bank, IMF, you, all of you are putting a lot of conditions about environmental compliance. Do you realize that in a country such as India, there is issue of poverty? So I have to first address the poverty issue before the environmental issues. And the President only remarked one sentence, and he said that when there is a great social cause, it is better to be provocative because only then you start thinking. I think this is exactly what Amir Khan did. He may have been provocative. He may have picked up examples to prove a point. But the fact is that there is some truth in all the things that he said. And why has it come? It has come because, like many other professions, in this medical industry, I call it industry just for the sake of understanding, there is one consumer who is demanding, that's the patient. And there are multi-agency suppliers. The doctor is a service provider. The hospital, the promoter, the pharmaceutical companies, they are all suppliers in some manner, equipments, etc., medicines. There is an insurance company also. Now, when it comes to that, in a kind of society that we have, there are going to be malpractices. It's not that we should gloss over it. We haven't really talked about the rural area and the health and the medical issues. But even in this city, I live in New Friends Colony, all the local domestic help there, if they go to a doctor, the doctor gives a prescription, he gives a medicine from his own shelf. He doesn't give the paper. No, clearly because he is not a qualified doctor. That's the reason. He doesn't want to leave any evidence. So you have a crowd in India which is group of doctors who are not qualified. They are practicing also. So there is a regulatory issue also involved with this. So unless we address all these issues in some holistic manner, there will be instances and instances, examples after examples where some kind of malpractice is there. I was in Washington, my domestic help got sick. The doctors there referred him to 5-6 different tests. They were all running into $1,000. What was the problem? When we came to India, he was given Zentek and he was all right. So, now based on that example, I can't draw a conclusion. Likewise, here also, I needn't draw a conclusion. But the fact remains that there is a scope for upgrading the respect for the doctor. There is a scope to bridge the ethical deficit which exists today in this medical society. And there is no harm if Amir Khan says that please prescribe, give in your prescription the generic medicine rather than the brand. So I think there are positives to what's being said, and it would definitely lead to upgrading of the medical profession in terms of, as he said, overall social respect for our medicine. They are great, no doubt about that. But perhaps there is still scope to address the matter ethically. Thank you.
Mr. Mishra suggest this is a problem which we all face here. I live in Daler City Phase 2 in Gurgaon. I know the maids who come to work. Somebody has a cough, somebody has fever, you suspect the worst. They go to a doctor and then they come and claim that, you see, he's been giving us injections every day, but nothing is happening. If you ask what is the disease, she doesn't know. If you ask for the prescription, it's not there. And he's charging 300, 200 rupees a day, which she can't afford. So she decided to go back home, her village. So I told her that, look, let me try. So I got another doctor to examine her. And he said, she just got bronchitis. It'll be cured. There's nothing, no need to give any injection. They give, and she's healthy now. The same person then said, I have lost appetite. I cannot eat. And they were giving all sorts of medicine. Then Dr. Neelam Bajaj sitting here. She said, you see, the malaria has affected her, whatever. And she gave medicine 3 days' time. She was cured and she's happy. So is there no way that you doctors who are well established, this Delhi Medical Station or Indian Medical Station, can't you have groups of doctors who have a day for such people? Like in the rural areas, I had a farmhand who had a small wound in his toe, and for 15 days he was going every day to this rural doctor who was giving him injection and charging him 10 rupees, and this is 1980. So he must have given 150 rupees, and there was nothing wrong, just penicillin ointment, and he was fine. So don't you think that to improve this is where the image of the doctors gets a hit? Don't you think that there is a way out for this?
Sir, this is again a big issue which we have to discuss in a different way. This is not for we don't have time, but let me briefly touch into this matter. The KK and myself, we joined the medicine in 1975. Since then, everything has changed. When we used to have Davidson, maybe 100 pages, and now the knowledge of medicine, if you go to internet, it is tremendous. We cannot practice the medicine which we have learned 25 years. Now we have to upgrade every day. There are the changes in the treatment, there are changes in the diagnostic, and this is the reality of today, that the technology has to upgrade it, and we have to grasp that technology. And from where this technology comes? From the companies. So we cannot, I'm just putting in, which is in my mind today, we cannot dissociate ourselves from neither from the pharma, because the pharma representative comes every day and they update about the salts, the newer drugs are coming up, we cannot avoid them to meet them, neither we can avoid the various technologies. The X-ray has come now in a way that we have got now, flat panel to the 3D, and everything has changed, and we have to practice that. If we have to maintain the quality, we have to give the services. As it being said that he is not comfortable in Canada, he is comfortable in India, because we have invested, the country has invested, we all, the corporate has invested, and we have technology, and we have grown from there. Now about the meeting or providing a cheaper solution or cheaper treatment, we all are doing this. Most of the corporate hospitals, IMA is doing a big way, and this is the kind of explanation you are seeing, that going from cities, the people take in a different way. When we go as Scar Heart Institute, where I am working since last 21 years, we had a COP, community outreach program, and I myself, though I am a cardiac surgeon, have more time to expend in my operating rooms. Myself and Dr. Neelam, we traveled together. You remember, we said 4 or 5 hours in Delhi airport to go to Jhansi. She was going to Gwalior. So we all are doing that. But the problem is that ethical again. Somebody will say that we are going and advertising ourselves in a rural area. So there are issues which has to be answered. Amir Khan has put it in different way. Somebody will say that, whoa, look, the doctor from Medanta or from Escort, they have come to Gwalior to advertise themselves, to catch the patient and take away to them. Now these issues are there, though intentionally we want to go, we want to treat. KK every year organizes a health mela. The issue is to propagate the health care to the masses, but then that is not the solution to me. The solution is that we should have a very strong health system in this country, and both private and government has to club together, and there are very good results which are coming out of private public. Yesterday I was in Jaipur, and the chief minister was there, and we were participating in one of the newer coming up heart setup. He came to inaugurate. He has told that in government of Rajasthan, in all the government hospital, the medicines must be available in the hospital. No doctors, no hospital can give a slip to the patient relative to bring the medicine. 100% hospitals, they have made a provision that anybody who comes for fertility treatment, 10,000, whatever their economic status is, government of Rajasthan is going to give for the fertility treatment 10,000. So that kind of initiatives governments are taking. We know there are a lot of initiatives in Madhya Pradesh, Rajasthan, in Andhra Pradesh for cardiac care, in Tamil Nadu. Now, instead, one day we were discussing about the knowledge, the information. KK, remember that day when we were talking about the valve, there are so many things which are available, people doesn't know. They doesn't know. A Scott Heart Institute, there is 10% BPL. We don't get enough of the patient to come and claim that we must get treated. So that's the problem, sir.
Vijay, I'll just like to clarify a couple of points, but some points have been Sanjeev Malik and Dr. Yugal Mishra has raised about pharma-doctor relationship. I must clarify certain things very clearly. That till the Act came, MCA amendment came in 2010, doctors were not aware that interacting with pharma is a crime. The amendment came in 2010, and after that amendment, most of the pharmas today are refusing to call doctors for the conferences. I only want to clarify one point is that Government of India today is not informing any doctor for the introduction of drugs, for the banning of drugs. I don't get. In the last 10 years, I have not received a single letter from the drug controller that new drug has been introduced. So I'm totally dependent on pharma. So we are not informed by the drug controller of India for any drug introduced. So if a new drug is introduced, the practice I'm doing today is different from what I learned. Who is teaching us? The pharma. That's one. Two, if a pharma wants an opinion, should I introduce this drug in India or not? Am I not supposed to charge? Am I not giving my professional service? Every pharma will come and say, tell us about your experience about this drug. You were supposed to charge. Because you were not charging, they were obliging you by sponsoring your conferences till 2010. And because Medical Council of India was silent about it, people were not aware about that. But now, most of us are conscious about it, and most of the people today are observing and absolutely honoring the Medical Council of India Act. Another thing which was raised was generic drugs. The doctor should write generic drugs. Absolutely. We all are ready to write generic drugs. Are they available? Where are they available? If I wrote, on the day Amir Khan's statement came, I wrote 15 generic drugs purposefully, and every prescription came back. The generic drugs are not available. There is no center in Delhi where generic drugs are available. Second, if Government of India is allowing two drugs, one at 1 rupee, same drug at 15 rupees, is the fault of Government of India, not mine. Why are they allowing the same drug at 1 rupee and 15 rupees? They should allow it only at 1 rupee. If government wants everybody to write generic drugs, why are they promoting branded drugs at all? Why not like in US, one drug, one company? Why you are allowing one company, one drug with multiple companies? Couple of things I wanted to add.